Hi, this is Dr. Naim, your favorite OBGYN. Today I'm going to talk about pelvic floor prolapse. There are different kind of prolapse in pelvic floor. I'm going to talk about it. This prolapse is usually caused by damage to the tissue of the vaginal area, usually from having children vaginally, especially if they're large babies, that causes it. Also, if somebody does heavy liftings or a lot of lifting exercise can cause that. There are different kinds of problem in the pelvic floor area. First one is when you have a bladder coming down, something called cystocele, or protrusion of the bladder coming down to the outside the vagina. That's number one. We also have something that can happen at the back of the vagina called rectocele, when the rectum area pushes through the vagina. These are all some kind of hernia that they call them, when there is a part of the body goes through the other side. These two are very common. The cystocele can cause urine incontinence or inability to control the urine. The rectocele can cause difficulty with the bowel movement or lack of control of bowel movement. The other one that's very common is when the uterus itself has a prolapse called presidentia, has different level. It could be mild. They can see it by coughing, or actually the whole uterus could come out on an older woman. Usually this happens. There are many options to deal with this situation. When you have somebody has just a cystocele or also urine incontinence, we can do bladder lift. Sometimes we just lift the bladder by surgery, or we can put something called a sling that lifts the bladder up, or mesh for better support. When there is a rectocele, especially if it involves bowel movement difficulties, again, we can do something called a posterior repair, and sometimes you can use a mesh to have a better support. If there is a vaginal, if it's a uterine prolapse or even vaginal prolapse, it can sometimes on older patients who cannot tolerate procedure, we can use something called a pessary, which is a plastic ring, usually looks like a ring that supports the uterus or the bladder also, or surgery which could involve the hysterectomy, vaginal hysterectomy. Usually this resolve it. Occasionally we have to do other procedure after a vaginal hysterectomy to have a better support. That's sometimes they have to attach the top of the vagina to some organ, usually to the back of the spine. When there's a small layer that they attach it to have a better support. It's a very complicated surgery, but that's sometimes needed for some patients who don't have a prolapse of the vagina after the removal of the uterus, which can happen sometimes. If somebody wants to not have any issue with the vaginal prolapse, an option is to decide to have a C-section, but it's usually not recommended to go that route, even though some patients do choose that, have a C-section because of that. Also, there's other options like Kegel exercise, when a patient can do to have a better support of the vagina by just tightening the vagina area. It helps also with mild rectocele or cystocele, which is, as we mentioned, prolapse of the bladder or the rectum. There's also certain chairs that certain doctors have them, usually urologists, that you can sit on it, and there's electromagnetic field that helps to have a spasm of the muscle around the vagina and make it tighter and more support. There's also certain other probes that can be inserted in the vagina by the doctors to have a spasm, and some of them with laser, some of them with electromagnetic waves. They can make that area tighter. Not all of them necessarily work as well, but there are options available in the market.